Hi, this is your Central New Jersey chiropractor, Dr. Perry Wolk-Weiss, here at the Get Well Center, located in beautiful, historic Bound Brook, New Jersey. What we're going to do today is we're going to talk about how we do a lower back examination on a patient. If you've never been to a chiropractor before, it could be a little bit uncomfortable going there for the first time, not knowing what to expect. So what I wanted to do with this video is to help to allay any fears or concerns you might have about what would happen when you come to our office to evaluate you for your lower back problem. So we have Lara here today. My assistant is going to help us demonstrate what we do during our examination. First thing I want to do is tell you, before we do an exam, we do a complete history on the patient, and we sit and listen compassionately to your concerns and what problems you're having with your back and how it's impacting your life on a day-to-day basis. Because what we want to do is ultimately find the cause of your problem so we can allow you to get back to doing your daily life as quickly and as effectively as possible. So we're going to have Lara first stand up for me. And first we check posture. The most important thing about checking posture, we start off with checking the shoulders. And we use this instrument called a scoliometer. And we take a look at that and can see from that it's like a level, and we can see that her shoulders are perfectly level. Sometimes patients come in and we can see their shoulders are out of balance. That can tell us a lot. That can tell us either there's a structural problem going on in the mid-back, or there might be some muscle weakness going on in the lower back area, allowing the shoulders to go off. Then we'll check the hip area. And Lara's hips are level as well as her shoulders, but we want to see the hips. Is one hip higher than the other? It's not normal to have that. And if one hip is higher than the other, that can tell us there might be a difference in the leg length. There could also be a problem in the lower back, causing the spine to shift and rotate, or causing the muscles to spasm. So we want to check to see if the hips are level. We want to check to see if the shoulders are level. We also want to look at the head and how's the head positioned on top of the shoulders. Does that person have their head a little too far forward? And we want to check that too. We want to look at the person as a whole, because posture gives us a window into what's going on with them structurally. Then we're going to ask the patient to see what kind of mobility they have to bend forward as far as they can go. Now obviously if someone's in a lot of pain, they're not going to move that quickly. So come on back up. And Lara's got pretty good range of motion, and we'll have her bend backwards obviously. And if she has pain bending backwards, that can tell us a lot, because when you bend back, you put pressure on the joints. If she has more pain bending forward, that pushes the disc back against the spinal cord. And that can tell us that they might have a disc problem versus a joint problem. The other thing we'll have her do is we'll have her twist and turn back. That puts pressure on the joints of the spine, kind of like bending your finger backwards. And if there's inflammation in the joint, we'll experience it because the patient will be uncomfortable with this. The same thing we'll do it to the other side. And then we have the patient sit down. So why don't you sit down here and move this out of the way. And while we're sitting, what we notice is that sitting puts the most pressure on the lower back of almost any position. So in the sitting position, if the disc is bulging out, it's going to bulge out even more. And we'll be able to tell that because we're going to ask the patient to do certain maneuvers while they're sitting. Obviously, we always check the reflexes because we want to see how the reflexes are functioning. It tells us how the spinal cord is functioning. Then we're going to ask the patient to straighten their leg, and they straighten their left leg. Now, she brings her leg up like this pretty easily, but if you have lower back pain and you have pressure on the sciatic nerve, very often that'll be painful and uncomfortable. Now, if the pain when she straightens her left side is more on the right side while she's straightening the opposite side, that gives us additional information about what's going on with the disc and where it might be located. Then we'll ask her to straighten the other leg out, same way. And we'll also ask her to bring both legs up, and then we'll ask her to bring her head down. Now that puts a lot of stress on the muscles of the back here, as well as putting a good stretch on the sciatic nerve, the longest nerve in your body that runs down the back of the leg. And if you're having pain in this particular position, but not in some of the other ones, this gives us further information, further clues on what might be going on. Put the legs down. That's great. Then we're going to ask the patient to lie on their back for me. Now, while we're doing all this, I'm paying attention. I'm observing the patient's posture, their demeanor. I'm looking at how you're functioning on the table. That all gives me clues in helping to decide what's going to be the best approach for your particular problem. Now, while she's lying down here, one of the things we'll start to do is we'll just raise the leg up. Now, if we get to a certain point, let's say only about here, and they have pain, that's not very far, and that tells me there's a lot of pressure. There might be a big, large disc putting pressure on the sciatic nerve. And we want to take a look and see how far the person can go. Now, if they can go up pretty far, and they feel no pain until they get to a certain point, and then it feels tightness in the back of the leg, that could mean just a tight hamstring problem. And hamstrings, if they're tight, are one of the biggest causes of lower back problems. So we would talk to her about working on her hamstring muscles, the back of the leg. And we'll do the same thing on the other side and see how she does with that. It also tells me about her hip joint and how her hip motion is and her ability to do that. The other thing that we'll do is we'll check the psoas muscle. The psoas muscle is an important muscle in the spine. It's spelled P-S-O-A-S. And it's a spinal muscle that a lot of people don't pay too much attention to, but it's probably one of the most important muscles when you're dealing with lower back problems. It attaches from deep in the abdomen, right about below the diaphragm on the spine, comes across diagonally to the hip. It's one of the first muscles we activate when we start to walk, so it's a very important muscle. Now what we'll do is we'll bring the patient's leg up, we'll ask them to rotate it out, and while it's rotated out, we'll ask them to resist as we push opposite. And if she has good strength there, that's great. Then we'll check the other side and see how it is on the other side and push. Now if it's weak on one side, I'm going to have her go weak on me, that tells me that there's an imbalance in the functioning of the psoas muscle. You want to have both sides equal strength. And if there's an imbalance on one side and the other side stronger, it's going to cause the spine to pull. It's going to cause structural weakness or lack of integrity. And then we have to figure out what's creating that psoas weakness. One of the big things that can cause that is for the pelvic bones or the hip bones to go out of alignment. And the hip bones are out of alignment, then that person's gait is off. They're structurally out of balance, and that can be contributing to the low back problem. Then we'll also test the muscle, bend your knee, and bring the leg in. And we'll test the muscle in the buttock area called the piriformis muscle. The piriformis muscle is the muscle that the sciatic nerve goes through. And if that muscle goes into spasm, if it's weak, it will spasm, and it will not function properly, and as a result of that, it can irritate the sciatic nerve. So one of the things we can do is ask her to resist, and she's going to pull in that direction, and I pull opposite. And she's really good and strong with that. And we'll do the same thing on the other side to see how that's functioning. Remember, we want to have both sides functioning properly. You know, if any of these tests start showing positive findings, we may do additional tests to give us more information of what's going on. So let me have you turn over on your stomach. One of the important things I check on all patients is their leg length. We want to see that their legs line up. Because if there's an imbalance in their leg lengths, what can happen is that can tell me that their pelvis is out of alignment. And if the pelvis is out of alignment, once again, it's like walking with one shoe on and one shoe off. I can't tell you how many people have come to see me with knee problems that are a result of no direct trauma to the knee joint, no other stress and strain other than the fact that doing some activity like gardening around the house or running in the woods or swimming or being on the beach where it's uneven, they threw their pelvic bones out of alignment. One rotated back, one rotated forward, and as a result of that, it changes their gait, and their knee is where it shows up the pain. And very often we'll fix that, and the knee pain will almost instantly go away. It's very common to see that. I'd be surprised how many chronic knee problems people have that lend up down a road to potential surgery started with just a simple thing like a pelvis going out of alignment, which can easily be fixed. The other thing that we'll do is we'll start to palpate the spine. We'll check the vertebrae and see how they're moving. Any restriction of movement of the vertebrae in the lower back can put pressure on the joints of the spine, straining them like bending your finger back, or cause that to swell and put pressure on the spinal nerves, giving you sciatic pain down the leg. We'll also want to see if the vertebrae is subluxated, misaligned, not working properly. Then we'll start to palpate the sacroiliac joint, the joint down the spine here, at the base of the spine where the hip meets the base of the spine. If that's inflamed, you could have sacroiliitis, which is inflammation of the joint. We check for trigger points or knots in this piriformis muscle and the gluteus medius muscle over here. And we want to see if there are any trigger points, because trigger points are knots in the muscles that can cause radiation of pain just from that trigger point alone, and that requires a different type of treatment. So we check for the trigger points. And let me get you to turn around. And I want you to sit up for me. And we pay attention to how they happen to sit up on the table. If someone's in a lot of pain, if you're in a lot of pain and discomfort, certainly we may not have you do some of these particular maneuvers. But this is a brief idea of what you can expect when you come to our office to look at your back and to evaluate for lower back problems. Depending on your particular symptoms and what's going on with you and the history that we took, I may add additional testing in this. I might send you for an MRI, or a CAT scan, or do x-rays on you, or do some additional orthopedic tests or chiropractic evaluations on you. But generally, this is what we do in our office to get a good idea, because the key is to figuring out what the underlying cause of a person's problem is, so we can develop a treatment program that will get you better in the shortest time possible, in the fewest number of visits possible, and get you back to living your life again. If you want more information about what we do here at the Get Well Center, visit our website at getwellcenter.com or give us a call at 732-356-1155. If you go to our website, we've got a great health newsletter there you can sign up for that's free. Once again, it's getwellcenter.com. Thanks and have a great day.